Senator Richard Blumenthal, the Democratic ranking member from Connecticut and a longtime champion of veterans' rights, sat across from VA officials and asked the questions this administration doesn't want answered. How did a program meant to serve our veterans balloon from $9 billion to $48 billion, with virtually no quality controls, no oversight tools, and no accountability? And where did $4 billion in overpayments go? While Washington talks about cutting costs and slashing agencies, the real waste may be hiding in plain sight.
Thanks, Mr. Chairman. Since 2019, the funding for, disregard this chart for a moment, since 2019, funding for the VA Community Care Program has increased from $9 billion to more than $48 billion in the VA fiscal year 2026 request. That's an increase of 530%. That's a staggering increase. Wouldn't you agree?
Ranking member, that's a large increase.
Over that same period, funding for VA direct care has increased by far less, about 200%, from approximately $50 billion to $70 billion. Why the disparity?
Ranking member, I think that goes back to my prior comments to the chairman that these numbers are not risk adjusted. And so what they show is we have more veterans receiving more care. It doesn't account for the type of care those veterans are receiving. I think back to the point the chairman made too, that they are receiving disproportionately emergency care, in-home and geriatric care, which are expensive services to provide. And so what I would say is the measure of this is not just the gross spending and what the difference is. What I'd say is, what is VA getting for it? And does VA have the tools to ensure that we are getting the highest value of care for those dollars and that we are maximizing our dollars to get the most that we can? Under the current community care program, we do not have those tools. We are the only payer program, the only government payer program that does not have the ability to manage quality, to manage cost, to use value-based, to use alternative payments, to do to have program integrity. We are the only program that does not have these controls. We are introducing those in NextGen. And so I share your concerns about the expenditures and the increase and ensuring that we are maximizing the value. This program gives us the tools to do that and to be accountable to the Congress, to our veterans, to be able to do that.
So just so I understand, you agree that more needs to be done to maximize oversight, to make sure that we get quality for the dollars that are being spent on veterans care, and your explanation for the disparity is that it's a different type of care, more specialized care, geriatric care that is provided in the community as opposed to VA direct facilities?
Senator,
is that a accurate summary? I'm trying to put it in
Senator, that's possible, but there are two issues here. Number one, we don't risk adjust that for what the care is that is received and what's driving those costs. So that's a dollar amount. What's behind it is not adjusted. So that's number one. And then number two, because we do not measure quality in the community care program right now, I can't tell you that the care is less or more different or better in the community versus direct care. We don't do that today. NextGen includes our ability to do this. That's a huge movement forward so that we can then compare. Are we getting more or less? Are we getting best value or are we not? I can't answer that for you now because the program isn't built to do that.
This chart indicates that the rate of increase in the numbers of veterans served has been far less than the rate of increase in the amount of spending. Ms. Seawright, do you have an explanation for that fact?
No, we haven't evaluated that in our ongoing audits, so I can't speak to that exactly.
Mr. Topping, do you?
Senator, what those charts show me is that we have more veterans receiving more care. That's what they show me. The ability to dive into what that care is, whether that's the right care, whether it's the appropriate care, whether there's good value for that care, that doesn't show me that. And the program today is not built to do that. NextGen is, which is why this is so exciting for us.
Well, I would suggest that we need to answer those kinds of questions. You don't have answers right now. you say that the program isn't designed to provide those kinds of answers, but anybody running a healthcare program would say, we really ought to be answering those questions. Wouldn't you agree?
Senator, I want to answer those questions, which is why we have designed NextGen to include these tools and capabilities. I want to answer those questions.
Okay. Talking about next generation, Ms. Seawright, your report indicates that we need to, and I'm quoting, community care providers should be incentivized to meet the same training and quality standards as VA providers. Isn't the word incentivized a little bit light on requirements? Shouldn't we absolutely guarantee that they meet the same training and quality standards as VA providers?
Providers, whether they're in the VA or in the community, have a standard that they are all trained to, right? But within VA, they are, have additional standards that they train to, the culture of the veteran, to serve the veteran. So, in our position, the VA is asking the community providers to do more, to have a higher level of education or awareness of the community that they're serving. So.
But I guess maybe saying instead of just incentivizing them, shouldn't they be absolutely required to meet the same standards of quality and training and efficiency and all of the criteria that a veteran going to a VA facility has a right to expect?
If it's within the contract, yes, they should be required.
In the contract, as a matter of definite provisions and requirements.
Correct.
And let me just ask you very quickly, finally, Ms. Seawright, have you looked into amounts of overpayments or lack of contract enforcement relating to community care since the enactment of the Mission Act?
Yes, we've done quite a bit of work in relation to community care since the enactment of the Mission Act. That work varies from, payment oversight to services provided. Our investigative division looks at fraud investigations and, things that evolve from hotlines as well. And in the payment integrity world, we also do annual reviews of the reports that VA provides on, underpayments and overpayments to community care as well.
Do you have an estimate as to how many taxpayer dollars have been lost to improper payments or lack of enforcement?
Since 2021, VA has reported about $4 billion in improper payments of overpayments to the TPA, which is about 4% of the total amount paid out.
$4 billion.
Yes.
Okay. Thank you. My time has expired on this round, Mr. Chairman. Thank you.
Yes, sir. Sir Sullivan.
Thank you, Mr. Chairman.
Senator Richard Blumenthal, a man who has spent decades fighting for veterans in this country, just laid bare the fundamental contradiction at the heart of how this government treats the men and women who served. The numbers are staggering, and they deserve repeating. The VA's community care program, which outsources veterans' health care to private providers, has seen its funding explode by 530% since 2019, from $9 billion to $48 billion. And yet, the VA's own officials sat in that hearing room and admitted under oath that they cannot tell you whether that care is any good. They cannot measure its quality. They cannot compare it to what VA hospitals provide directly. They have no cost controls, no value-based metrics, no program integrity tools. The only major government payer in America operating essentially blind. And then came the number that should make every taxpayer sit up straight. $4 billion in improper overpayments since 2021. $4 billion. That's not a rounding error. That's a scandal hiding behind bureaucratic language. The Mission Act, signed in 2018, was sold to the American public as a way to give veterans more choice. And on paper, that sounds wonderful. But what it effectively did was open the floodgates to privatization of veterans' health care without building the guardrails to ensure accountability. Private providers got the contracts, private companies got the dollars, and nobody was checking whether veterans were actually getting better care, or any care worth the price tag. And here's where the political context matters. While certain voices in Washington are busy slashing federal agencies, gutting the civil service, and telling you that government is the problem, the real waste, the real inefficiency is sitting right here in a program that funnels billions to the private sector with no oversight. Senator Blumenthal pressed on something else that deserves your attention. The Inspector General's report recommended that community care providers be incentivized to meet the same standards as VA providers. Incentivized, not required, not mandated. Incentivized. As if asking private companies to please, if they wouldn't mind, maybe treat our veterans with the same level of care they'd receive at a VA hospital. Blumenthal rightly called that out. If you're getting billions in taxpayer money to care for veterans, meeting quality standards shouldn't be an incentive, it should be a condition. The VA official, Mr. Topping, kept pointing to something called NextGen, the next generation of the community care program, as the solution. And perhaps it will be. What Senator Blumenthal demonstrated today is exactly what congressional oversight is supposed to look like, asking uncomfortable questions, demanding real answers, and refusing to accept bureaucratic deflection as a substitute for accountability. This is the work of democracy. Tedious, unglamorous, but absolutely essential. The veterans of this country were promised that their service would be honored with world-class care. The evidence suggests that what they're getting instead is a system where billions flow out the door. Quality is unmeasured, and the only people guaranteed to benefit are the private contractors cashing the checks.